Hello and welcome to the NB Media Co-op. I'm at the office of the NB Federation of Labor in Moncton with the Federation President Danny Légère to talk to us about some recent news from a labor perspective. Thanks for joining us again, Danny.
My pleasure, David.
Let's start with the issue of healthcare and specifically the privatization of healthcare, the delivery of healthcare services. As you know, the Globe and Mail recently published an investigation that revealed the extent of government spending on companies that provide temporary nursing services, also called travel nursing services. One of those companies, Canada Health Labs, charged fees amounting to roughly $300 per hour for nursing services, or roughly 6 times what a nurse on staff at a hospital in Atlantic Canada typically earns. And of course, NB, New Brunswick's Vitalité Health Network, was that company's biggest client for these so-called travel nursing services. What do you make of this story?
Quite frankly, the labor movement's been ringing the alarm bells for quite some time about the impending chronic shortage of nurses in the province. Those fell on, for decades. We've been raising those alarm bells. The pandemic came and we've seen the consequences of the inaction on that file. The salaries that they're paying travel agency nurses is just it's quite shocking when you consider the contradiction in the way our homegrown nurses are being treated. They go into work, they don't know when they're going home, they're called in constantly for extra shifts. That's not only hard on the individual, but it's hard on the family and hard on the community. The travel nurses, on the other hand, just fly in, they pick up predictable shifts, they're compensated much more than our New Brunswick nurses who are working side by side with them, and they don't have the level of expertise necessarily in the floors or in the hospitals that they're working in, and they don't necessarily contribute to our communities. They're obviously not the hockey coaches or hockey moms or soccer moms, and that takes a toll on the people who stuck it out, who keep putting in shift after shift, extra shift after extra shift in our healthcare system.
As you say, this has been a long time coming, these warnings about recruitment and retention. And the NB Nurses Union President Paula Doucette has said that they recognize, the union recognizes that these travel nurses have helped fill a gap in staffing in underserved communities, but that this situation exists because government has ignored recommendations from labor in terms of recruitment and retention. So, at this point, do you have the government's ear on this topic?
Unfortunately, the relationship between labor in general and the Conservative government is more of a confrontational relationship, failing to recognize the contribution that's made by government's own workers and addressing recruitment and retention issues right here in the province is compounding the problem.
It's interesting to see this political debate unfold about the healthcare privatization issue, because now there's not only Labor, the Green Party opposing privatization, but also the Liberal Party under Susan Holt. She told the NB Media Co-op it's part of her refresh of the party. Of course, the NB Liberal Party previously pushed for privatization under Brian Gallant, which handed over management of extramural and telecare services to Medavie Blue Cross in 2017. They weren't always successful in their push for privatization. The attempted handover of food, cleaning, and custodial services to the French multinational Sodexo was eventually abandoned by the Gallant government in 2018 after a pushback from organized labor. So can you talk about how that all went down?
Well, there was there was a lot more dialogue with the Gallant Liberal government. The relationship was, I guess, a little more cordial with the government of the day. And as a result of meetings and different committees put up, and arguments being made and listened to by Labour that this was the wrong way to go, ultimately that decision got overturned, and the whole idea got scrapped. But in order for that to happen, you got to listen to Labour. You got to have a dialogue first of all, and you got to be treated. Labour has to be treated as an equal partner at those tables, which happened in that instance.
In that instance, but previously, Labour had pushed back against the Medivh Blue Cross privatizations, didn't it? And when you hear Susan Holt saying that now the Liberal Party opposes healthcare privatization and would even look into re-examine, she said, the contracts with Medivh Blue Cross to ensure no profit is being extracted. I asked Susan Holt if she thought the Liberal Party has a credibility problem on this issue, and she said, well, this is my refresh of the party as the new leader. She hasn't been party leader very long. What's your take on that?
She hasn't. I believe I read something. She hasn't even been a member of the party for very long. But that's we'll see how that plays out. I mean, that is certainly comments that we like to hear. But historically, the Liberal Party's been the party of privatization, P3s, very big on private-public partnership, which costs the taxpayer more than if the government builds infrastructure and owns it. The other part about privatization is the whole question around accountability. When you hand things over to a private third party, whether it's a non-for-profit or for-profit, then the people in New Brunswick lose a question or a point of accountability. Those private entities answer to their shareholders, not to the people in New Brunswick. So that's the other dangerous piece of privatization. It costs more, there's no accountability, and there isn't always a lot of transparency for how tax money is being spent.
So, possibly the Liberal Party turning a new leaf on this issue. On the other hand, when I interviewed Bruce Fitch, the health minister, he defended the private delivery of health care services, saying, for example, there's always been private delivery of, with doctors. Many doctors are essentially entrepreneurs or sort of corporations if they exist outside of hospitals. And then big pharma, he pointed to this kind of thing, this kind of all this involvement of private business in healthcare. And, when I said, well, what about the sort of long-standing argument from Labour that, more privatization is just going to make things worse? Well, then he pointed to this private clinic in Bathurst that's offering cataract surgery. The Conservatives often point to this example, kind of trotting it out and saying this has taken pressure off the hospital system. The CBC has reported even the physician behind that clinic in Bathurst has warned about too much for-profit interest in the private system, potentially making it worse. But according to Fitch, this has taken pressure off the hospital system, so he sees it as a model. And as you know, Higgs has said everything is on the table, including more privatization. So how do you respond to these kind of pro-free market arguments?
Encroachment of privatization also does a human resource. We talked about shortages of human resources in the public healthcare system. Well, where do the people that are going to work at these private clinics, where do you think they're going to come from? They don't drop from the sky. So it's a bleed on our public system. The other part about privatization, I mean, there's I've been at this for quite long, and I've seen how a number of privatization setups work. Companies will start and they'll take a piece of publicly delivered services, and they'll run it quite cheap for a while, till whether it's a municipality or a province gets rid of the infrastructure. And once the municipality or the province gets rid of the infrastructure and the private entities have a monopoly, then the prices start to skyrocket, because we can make no mistake about it. Private companies, for-profit companies, are in it for profit. And that's how they work. I'm not saying that's a bad thing, but it's bad if it's in it's in the delivery of public services. There's no room for profit in public healthcare, and all of our healthcare should be public. So we've seen a gradual encroachment of privatization. You mentioned Medavie. There's other examples as well. In the Medavie case, it's the management. That's how it starts sometimes. It starts with the management, and then you start to see bids to get parts of the service into private hands. And at the end of the day, if you look all the way down to the end of that rope, it's a pretty scary place, because what it is, it's a setup for a two-tier system. The common folk will be stuck in the private system, and those with the platinum credit card will be able to jump queue and get, as we see the American model, I guess, get service a lot faster by paying for all, if not a portion of that healthcare delivery. So healthcare seems to be going down that road, which is quite alarming.
On the issue that you mentioned of workers, healthcare workers, professionals being siphoned off from the public system, Minister Fitch did speak to that as well by way of anecdote. He said that he had met a nurse from one of these private companies who said that, as it's detailed in this article on nbmediacoop.org, that she had delayed her retirement, that she had had it, and that she was planning on retiring from the public system, but that she saw this as an opportunity to delay her retirement. So the way that he put it was something along the lines of, it kind of, provides an opportunity to prolong her career, which, I thought was an interesting example, because in a way it kind of suggests that that this person might have been working longer in the public healthcare system if conditions had been better, doesn't it?
And probably they probably feel a little more appreciated by their employer than the public sector nurses do.
I guess this is part of the sort of part of the brain drain that occurs, and the drain of resources, that after someone gains all this experience, then it's private entrepreneurs who can benefit from that public investment.
Absolutely. Yeah.
With respect to this cataract surgery clinic, it's interesting. It's an often cited example. I think the Minister of Health mentioned it in question period this week, I believe.
Are having effect. We have decreased the wait line and wait time for cataract surgery. We have decreased the wait times for hip surgery. We have decreased the wait time for knee surgery. Mr. Speaker, we are making...
There was a report from the Parkland Institute out of Alberta in May of last year that said, actually, in the case of Alberta, the emphasis on for-profit surgeries, quote, has failed to improve wait times for all other kinds of surgical operations other than cataract surgery. So it seems like there's something particular about this kind of operation.
Yeah, well, we don't want to lose sight these private entities are in it for profit. So they're going to take the cream. They're going to take the easy stuff in and out without complications, where the public system has to do the full gamut from A to Z. And one thing that these private clinics don't have to deal with is if there's complications that arise out of these private surgeries. Where do they go? They go right back into the public system to deal with the consequences of mistakes or things just not going the way they should have.
Okay, and shifting gears a little bit, this week the feds announced two separate agreements with the province of New Brunswick, totaling about $430 million for health and long-term care. So a big bilateral agreement between the feds and the province. There was a lot of detail in this announcement, but one of the items in particular that jumped out at me was that this is meant to support, quote, recruitment, retention, and training initiatives for health workers. And in particular, it says the health system will implement initiatives that improve safety and reducing stress in the workplace. I asked Minister Fitch for some details on this, and let's go to a clip now of what he said.
Right. Well, part of that whole discussion on the workplace and the safety and having enough people on the shift to make sure that you're not short-staffed, that's where that retention comes into place. So whether it's increasing the number of RN students in schools, when we took over in 2018, there was about 888 RN students. Last count, there was 1,689. So we've almost doubled the number of students going through the system, and UNB St. John has actually reduced the number of years to 3 as opposed to a 4-year degree. So having the international recruitment, having the recruitment throughout Canada, and also having more students will make sure that there are appropriate number of people and the appropriate number of care providers to make the workplace safer. And if workplace safer, it's a better experience. People tend not to be as disheartened and consider leaving.
The whole question around international recruitment, there's a couple problems with that. One, the world hasn't got, no one country's got an abundance of nurses. So when you go and you raid or poach nurses from another country, you're leaving that country worse off. And I would like to think that Canada's got a bit of a social conscience and would hesitate to do that, but apparently not. The other part of that is that New Brunswick is a relatively small province, and we're going into a high-stake poker game here with $100 in our pocket. We'll never outbid some of the richer provinces or some of the places that have got a greater ability to pay than we do. And you're not addressing the problem of keeping your homegrown nurses in the province. Actually, you're probably aggravating it.
Just the other day, The Guardian, the British newspaper, published a report on how the recruitment of nurses from the global south is regarded by the International Council of Nurses as a, quote, new form of colonialism, effectively worsening healthcare in countries like Rwanda, for example. And then it seems that arguably the government is using workers from overseas as sort of a release valve for kind of pressure from organized labor instead of improving working conditions and wages that would attract more people to nursing domestically or at home in New Brunswick. Would you agree with that assessment?
I would. It's a short-term fix to a long-term problem. It's a Band-Aid for a cut artery. Our experience in not just New Brunswick but the Maritimes is immigrants or international workers tend not to stay in New Brunswick. They migrate to the bigger centers where there's a greater sense of community for them. So you might be able to attract on the short term international nurses. Will they stay? Will you be able to keep bidding paying the going rate? And at what point does that surplus of nurses dry up from other countries?
You were recently in St. John as part of a protest against this during this $600 plate fundraising dinner for the provincial Conservative Party that was attended notably by federal Tory leader Pierre Poilievre. There was a protest held by CUPE there, and a separate Gaza Solidarity protest as well. What was the message from organized labor?
Well, CUPE took the lead on that, and good for CUPE. A number of locals pitched in and bought bread and meat and made up a whole bunch, hundreds of bag lunches for people living in poverty. And I believe one of the intents of the event was to draw a contrast from the Premier Higgs having a $600 a plate of fundraising supper to the reality that a lot of New Brunswickers are facing. A bag lunch was probably, I've seen some of the folks picking up the bag lunches, and that was probably the best meal they had that day. So it certainly was effective in my mind of drawing that contrast. That there's people in New Brunswick who are really hurting, and there doesn't seem to be a lot of desire to address a lot of those inequalities, economic inequalities and social inequalities that exist in the province. And certainly I don't know how many people were in there eating $600 plate suppers, but There was a lot of folks very grateful to receive that a lunch bag with a juice box, a couple sandwiches, I think, and a granola bar.
Finally, Danny, 3 leaders from the Canadian Union of Public Employees were banned from not only the Legislative Assembly, but the entire surrounding block, which is known as Parliament Square in the provincial capital, in response to union members disrupting a vote on December 12th for a bill that, as you know, forces thousands of unionized public sector workers into so-called shared risk pensions. We talked about this last time. As we previously reported on the NB Media Co-op, critics say this act effectively guts free collective bargaining rights. Let's go to a clip of the moment when that bill was passed. You know, certainly a rowdy moment from the public galleries there, not the first time.
Yeah, I don't know if I would describe it as rowdy as much a very disappointed and an emotional moment for the folks who were in the gallery. You know, you had mentioned in your comments that it disrupted the vote. Well, the vote went ahead. There was no disruption to the order of business in the legislature. They plowed forward and got the vote, the bill passed. But I guess you got to reflect on the significance of what Bill 17 is. In the labor movement, there's what we call, certainly I refer to the holy grail of the labor movement, organized labor. There's only 2 things written on that holy grail. One is you don't break signed collective agreements, and you don't mess with the free collective bargaining process. And this piece of legislation did both of those things. So significant attack on the labor movement, both private and public sector unions, because by the fact that at the last minute the Conservatives decided to throw the nursing homes into this kettle of fish, they introduced legislation that did those 2 things in the holy grail, not only to public sector unions, but to private sector unions. And this sent a ripple through organized labor, both in the private and public sector. And the reaction to this legislation, I don't think we've quite seen the end of it yet.
Well, it's before the courts now, isn't it?
The CUPE has filed for an injunction on that bill.
And your reaction to the decision to ban these 3 leaders over this, maybe we could call it so-called disruption on December 12th. Steve Dross, Sandy Harding, and Sharon Tier, all senior CUPE officials.
Well, they were centered out. It was, make an example of these 3 leaders and we'll ban them. They certainly weren't the loudest, and they weren't the only ones that expressed their disappointment in this piece of legislation. And they were centered out, I believe, by the Premier. I noticed that when the bill was passed, the Premier leaned over to the Public Safety Minister, Chris Austin, and made some type of comment and wasn't too happy with it. But at no time did the Sergeant at Arms ask for quiet or people to calm down or have anyone escorted out of the legislature. All of these sanctions came in well after the fact, without the matter being dealt with when it maybe could have been dealt with.
Well, I've been speaking to Danny Légère, president of the NB Federation of Labor. Danny, thanks for speaking to the NB Media Co-op today.
It's always my pleasure.
Je dois vous dire, c'est vraiment le fun d'être ici parmi tellement de visages familiers, des amis ainsi que des collègues. Thank you so much for all of you for joining us today. It's really great to be surrounded by many familiar faces in the crowd. Pour ceux qui ne me connaissent pas, je m'appelle Ginette Petitpas-Taylor. Je suis la députée pour la circonscription de Moncton, Riverview et Dieppe et je suis votre maîtresse de cérémonie aujourd'hui. I'm extremely happy to be joined today by my friends and colleague. First and foremost, the Honorable Mark Holland, Minister of Health. Mark, thank you so much for being with us today, and bienvenue en Acadie. Nous sommes toujours contents d'avoir des invités spéciaux dans notre coin. Aussi, Dominique Leblanc. Merci. Je pense qu'habituellement, on dit juste Dominique. Dominique is like Cher. He doesn't really need the formal introduction. Just the first name kind of works. So there we go. But Dominique, always great to see you here today. I'm also pleased to be here with Bruce Fitch, the Minister of Health, Provincial Minister of Health, and also Kathy Bacchus, New Brunswick's Minister for Seniors, and last but not least, Sherry Wilson, the Minister of Mental Health and Addiction. So thank you so much for being here today. Nous sommes très heureux d'être ici parmi vous aujourd'hui pour cette annonce importante qui contribuera à améliorer les services de soins de santé et l'accès à ceux-ci, tout pour les résidents du Nouveau-Brunswick. Formerly, when I was the Minister of Health, I had the privilege of working with my home province to reach the first bilateral agreement supporting home and community care, mental health, and addictions. I was thrilled to be here then, and I'm again thrilled to be here today to see this collaboration continuing. J'aimerais aussi prendre un instant pour vraiment remercier l'hôpital Georges Dumont qui nous ont bien accueillis aujourd'hui, puis aussi de dire un gros merci à tous les travailleurs de la santé qui font un travail incroyable jour après jour ici dans la région du sud-est du Nouveau-Brunswick. Like many of you here, we've all had family and friends that have had to access the services here at the hospital, and I just want to say thank you for the work that you do day in and day out. Not always easy, but we certainly appreciate all that you do. Thank you. Votre travail fait une réelle différence dans le soutien à la santé et le mieux-être des membres de notre communauté. So, now let's get this show on the road for the announcement. Before that I do the formal introduction of our first speaker, I also wanted to advise the media that we will be here afterwards for questions and scrums. So now it is my honor and privilege, as I've indicated, to welcome my friend and colleague, the Honourable Mark Holland, Minister of Health. Mark was first elected as the Member of Parliament for Ajax, Ontario back in 2004. And as the Member of Parliament, he served as the Leader of the Government in the House of Commons. He's also served as the Chief Government Whip and Parliamentary Secretary to the Minister of Public Safety, Emergency Preparedness. He's been a staunch advocate of helping marriage equality rights and played a key role in helping to reform Canada's animal cruelty laws. In both private and public roles, Minister Holland has backed health-related initiatives. He has served as the Executive Director of the Heart and Stroke Foundation of Canada's Ontario Mission, and as well as the National Director for Children and Youth. And I have to say, having worked with Mark for the past 10 years, he is a strong advocate when it comes to mental health issues and all health-related issues. And Mark, we've seen you work tirelessly over the past 7 or 8 months, and we're truly thrilled to have you here in Moncton. So without further ado, let's give Mark a warm welcome.
Merci beaucoup, Jeanette. C'est un grand plaisir d'être ici avec vous et à Moncton pour une annonce aujourd'hui vraiment important, mais pas juste pour Nouveau-Brunswick, mais aussi pour notre pays. Et c'est vraiment avec un esprit de coopération que toutes les choses sont possibles. Et je veux commencer de dire un grand merci à Bruce Fitch. C'est un grand plaisir de travailler avec vous, Bruce, et votre travail dans ce dossier ici. Cette annonce aujourd'hui est possible avec votre collaboration et merci beaucoup pour ça. Et aussi, c'est un grand plaisir d'être ici avec mon ami Dominique, qui est quelqu'un absolument remarquable. Mais l'histoire de Dominique récemment, c'était une histoire remarquable aussi. Et c'est un bon exemple de notre système de santé, mais aussi les qualités de santé ici à l'hôpital du monde. You know, Dominic and I were seatmates. And Dom would talk about his journey and about the extraordinary doctors and nurses who came to his aid in his moment of darkness. And we know he wouldn't be here without you. And we're going to talk today about the challenges that exist in our healthcare system. But it's so important to take a moment how lucky we are to have a system that whether or not you're a minister of the Crown or you're somebody who comes in without a penny in your pocket, you're going to get the exact same care. The doctors and the nurses here, the personal support care workers, what they did for Dominic, let me just first of all say, because my good friend is still with us and serving this country, Thank you. And, I had my own experience just 2 weeks ago. My son was in a terrible car accident, and I was very worried for his life, and he was sent to Sunnybrook, where he received extraordinary care. And that care would have been provided to him whether or not he was on his own, again without a penny, or he was the son of a health minister. So when we're having these incredible challenges, it's important to remember we really do have the most extraordinary health system in the world. And when it's there, a needed, boy, do our doctors and nurses and personal support care workers show up. C'était un temps vraiment difficile pendant la pandémie. C'est un temps difficile pour tout le monde, mais c'était particulièrement difficile pour le médecin et l'infirmière. It was a time of challenge and difficulty beyond all reasonable asking. And yet, healthcare workers in that moment all came together without complaint, with a singular focus on helping us get through that. I also want to thank you for that. And you came out of that period and rightfully expected you were going to get a break. That view of coming out of the pandemic and all of that hard work, that you were going to be given an opportunity to rest. But backlogs and burnout meant that actually the challenge got bigger, not smaller. And a lot of the stresses that had already existed in our health system became more evident. Ça, c'est la raison pour laquelle nous sommes ici aujourd'hui. C'est notre tour de prendre d'action et de s'assurer qu'on peut améliorer notre système de santé maintenant, mais de faire des changements majeurs dans notre système avec des transformations qu'on a besoin. Because it's that spirit, to me, that is so remarkable and shows us what's possible. In that brief moment in the pandemic when everybody was pulling all in the same direction, when we set aside jurisdiction and we set aside partisanship and difference, we were showing how much could be accomplished in our health system by working together. And that's certainly the spirit with which we are here today, and it shows us what's possible. And so I want to say to you that this agreement is a starting line, not a finish line. That the investments that we're about to announce and talk about today are the start of what we need to do to transform our health system, so that you on the front lines who've been working tirelessly through the pandemic and the days afterwards can know that each day in front of you is going to get better, and that our public health system is going to receive the support that it needs. That's why I'm so pleased to be here today to announce two agreements that will see close to $430 million flow into New Brunswick healthcare system. These agreements are tailored to meet the unique needs and challenges of New Brunswick. Together, they represent an extremely important step forward. The first of these agreements is worth more than $313 million. It will increase coordination, just to some examples, increase coordination and access to primary care, which includes investing in mobile x-ray programs for nursing home residents to help reduce the number of transfers and non-urgent visits to hospital. It will support recruitment, retention, and training initiatives for health workers. This will be done by implementing a practice readiness assessment program to support the transition of up to 10 international medical graduates into the workforce each year. It will modernize healthcare systems with health data and digital tools by improving timely access to both virtual and in-person primary care. It will expand the delivery of culturally appropriate mental health and substance use services, and I know that my colleague Dominic LeBlanc will have more to say on that soon. We're also announcing the Aging with Dignity Agreement, providing close to $117 million over the next 5 years. This funding will help people in the province age closer to home. Ce financement aidera les habitants de la province à vivre plus près de chez eux, ayant accès à soins à domicile ou un établissement de soins de longue durée sécuritaire. Nous devons nous assurer qu'après une vie de contribution et de labeur, les personnes âgées profitent de leur retraite dans la santé et dans la dignité. Quickly, some examples of how that funding will be put into use is improving home and community care systems and palliative care, including opening new locations for patients and their families to access integrated residential hospice services. strengthening the long-term care workforce through improving training for staff across the entire long-term care continuum, aligning quality and safety measures across the long-term care sector to prevent premature entry into nursing homes. Together, these two agreements represent an important step forward. But mixed with our actions on pharmacare, on dental care, where we're looking upstream, the work that we need to do together on interoperability, on data, on the Safe Long-Term Care Act, I just want you all to know that help is coming. And that the force and that you met the challenges of those dark days during the pandemic inspires all of us to make sure that we make the changes in our health system, to make sure that we have the best health system possible. I appreciate the opportunity to be with you here today. Thanks so much. And with that, it is my pleasure to introduce Dominic LeBlanc, the Minister of Public Safety, National Security, Intergovernmental Affairs, and Democratic Institutions. He's got a few jobs there.
Merci beaucoup, Marc. Toujours un plaisir d'être avec toi. It's for Ginette and me to have our friend and colleague Marc come to Moncton on a Tuesday morning with this important news, and to do it here at the Georges L. Dumont University Hospital Center. Marc, means a great deal to me personally, but thank you for your friendship. And you develop a certain camaraderie. Ginette probably had the same experience. In the House of Commons, you share a desk. So you have a seatmate, right? You have one desk, two people, two chairs, but one desk. So the people you share the desk with, you spend hours chatting away. There's votes that go late at night, all night in some cases. So you develop a cheerful and positive and fun relationship with the women and men you have a chance to share that little space in the House of Commons with. And Marc and I had a couple of years together at that moment. And Marc, it means a lot to me that you're here. Thank you very much. Je suis aussi très heureux, évidemment, d'être ici avec mon amie, ma voisine, Ginette Petitpas-Taylor, et nos amis, les ministres du gouvernement du Nouveau-Brunswick. Marc a souligné le partenariat important de notre gouvernement avec les provinces à travers le pays. Moi, comme ministre des Relations intergouvernementales, j'ai une certaine perspective sur l'importance de ces relations-là. Et je salue nos ministres du gouvernement provincial pour leur partenariat et leur travail en partenariat avec nous et le gouvernement du Canada. As Marc noted, I have come to the Georges Dumont University Hospital not only as a member of Parliament or as a minister. Marc correctly noted that I came here as a patient. I see some of the doctors who were so kind in treating me. I tease Dr. Rémy Leblanc and Dr. Linda Leblanc. They're not all Leblancs, the doctors here. I was like, Dr. Leblanc, like paging Dr. Leblanc, half the room leaves. Dr. Finn was my doctor and Dr. Chantal Arsenault. Mais les soins que j'ai reçus ici étaient extraordinaires. Les femmes et les hommes que Marc a décrits, qui m'ont soigné dans les moments extrêmement difficiles, c'était la veille de Noël quand j'ai rencontré Rémy aux soins intensifs à un moment donné, il y a 6 ans. J'étais extraordinairement chanceux. Et moi, je voulais juste témoigner ici à votre hôpital, devant vous tous, l'appréciation, le respect, l'admiration que j'ai pour les soins que j'ai reçus. Et comme Marc a dit, je sais que c'est le cas qui se répète tous les jours, toutes les semaines chez vous. Vous faites un travail remarquable. On a souvent tendance à regarder des défis, des files d'attente, des choses qu'on peut améliorer ensemble. Et c'est vrai, comme Marc a bien dit, mais c'est aussi vrai que quand on est vraiment malade, il y a des personnes extraordinaires qui se dévouent à leurs patients. Et moi, j'étais témoin de ça d'une façon extraordinaire. So I'm happy to be here with my colleagues for what is an important announcement, we believe, for the future of healthcare in our province in New Brunswick. I had an opportunity about a year and a half ago with Marc's predecessor as Minister of Health, Jean-Yves Duclos, after the Prime Minister had a meeting in Ottawa in February last year with all of the premiers, to talk about a long-term funding agreement between the Government of Canada and the 13 provinces and territories. And then Jean-Yves and I took to the road. We saw 13 provincial premiers and health ministers in about 8 days across the country. And I remember that meeting, Bruce, we had in St. John with Premier Higgs. Right away, the government of New Brunswick said they wanted to be a partner with the Government of Canada. They wanted to work on a shared action plan that I'm sure our provincial colleagues will describe. But it was an easy and constructive relationship with the Government of New Brunswick from those first conversations. And I think it's important to say that. It took some time to work out the detailed agreement that Mark and Bruce are announcing today. But I was proud as a New Brunswicker, and Jeanette and I spoke about this often, in terms of the desire for the Government of New Brunswick to work with the Government of Canada, not simply to hassle about how much more money can the Government of Canada send the provinces. That's always in our federation a back and forth discussion. I think John A. Macdonald convened the first meeting where the Prime Minister met premiers to talk about funding of different programs. What I liked about that conversation is you had governments across the country concerned about patients, about healthcare workers, about a system, as Mark said, that was facing stresses from the pandemic, but stresses that existed before the pandemic and have become, as all of you know better than certainly I would, in some cases more complicated coming out of the pandemic. So the focus was on what can we do to improve a world-class healthcare system that's accessible to everybody in a way that's affordable for the taxpayers that fund it, but with a focus on patient service and on outcomes. And that was the conversation that we had across the country. And that's the work that Mark has done in the last number of months. Mark and I stayed up a bit too late at my house in town last night. And this is the 12th announcement that Mark has made in recent weeks across the country. There's one more after Moncton today. But Mark, you have, on behalf of our government, done a remarkable work in finalizing these agreements, which we hope will be an important step, not the final step, as you said, but an important step in improving a healthcare system that's so cherished by Canadians in every part of our country. Alors Marc, je te salue, je te remercie pour ton travail. Ginette l'a bien dit, Mark est quelqu'un dans sa vie personnelle et dans sa vie professionnelle en dehors de la politique qui a toujours été intéressé dans les questions de santé et qui s'est donné comme mission professionnelle et personnelle de travailler dans le domaine bien avant que le Premier ministre lui a demandé d'être le ministre de la Santé du Canada. Alors, quel privilège de t'avoir à Moncton et merci pour ton travail. Et avec ça, je tourne la parole maintenant à notre ami Bruce Fitch, le ministre de la Santé du Nouveau-Brunswick. Bruce.
Well, bonjour à tous et bienvenue à Moncton, Minister Holland. Et c'est un grand plaisir pour moi d'être ici aujourd'hui pour cette annonce. Quand vous avez 3 ministres fédéraux, 3 ministres provinciaux, tu connais bien, c'est une bonne annonce, une big annonce, grande annonce aujourd'hui. And I know I want to say thank you as well to all the medical staff here at this hospital and right across Horizon and Vitality. And I sometimes mention that my parents were involved in the medical field. My father was a doctor, pediatrician, and sometimes he would work out of the Dumont Hospital, sometimes out of the Moncton Hospital. And during the summers, he would do clinics up Tracadie, Rishbuckto. And the reason I mention that is because I know the sacrifices that families make in order for their parents or siblings to be doctors. And so through that story, I want to say thank you very much. Je vous dis merci beaucoup pour votre bon travail dans le système de santé ici à Nouveau-Brunswick. Parce que ton travail fait le système améliorer jour avant jour avant jour. So continue your good work. Thank you for what you've done. And I know many people are going to be coming and telling me how to spend this money, and some will probably want me to spend it 14 times over. but that's the work we do, and it's great to have Minister Holland here in the Greater Moncton area. When, as Dominic said, we started with Minister Duclos a year or two ago, a year and a half, I guess, in St. John, and then the portfolio switched. And as you know, we have a Minister Holland here in New Brunswick. So when I received the first invitation to talk on healthcare from Minister M. Holland, I picked up the phone and said, Mike, why are you sending me this email and wanting to talk about, and of course, he freaked. He thought someone was impersonating him. And as you know, nobody can impersonate Mike Holland other than himself. So anyways, we got it sorted out, and it was Minister Mark Holland. Anyways, so we met, and we became friends. He's a very personable fellow, much like our other two ministers here today, who do a great job in representing the Federation here in New Brunswick. And Mark found this room, so if you can find this room, then you can run the healthcare system in Canada for sure. But I lost a lot of sleep last night because Dominic usually has a good zinger for me, and usually 2 or 3 during a 10-minute speech. So I was trying to come up with something, and I had nothing. So he didn't zing me today, so that's good. We're going to be even. Thanks, Dominic. Great to see you, and thanks again. And you know, we're pleased to see that the federal government has acknowledged the Made in New Brunswick solutions here in the province. We've been working very, very hard to implement our health plan, which is again gone through a couple of years, and I'm proud that we just unveiled one of the biggest budgets for healthcare here in the province of New Brunswick, to the tune of about $3.8 billion. And that's an increase of almost $1 billion since 2018. So there is a significant increase in the financial contribution, and we appreciate the federal government helping us out there. Et nous avons fait le progrès considérable jusqu'à présent. Nous n'attendons pas d'être l'action nous agressons. La population de Nouveau-Brunswick devient plus vieux. Nous avons 20% plus d'années que le reste du Canada. Dans les prochaines 15 ans, on attend que ces 3 Nouveau-Brunswickois ou Nouveau-Brunswickois seront 65 ou plus vieux. Moi-même. I had a significant birthday the other day. We won't get into that. C'est l'une des raisons pour lesquelles de devoir rester attentif aux longues listes d'attente pour l'intervention chirurgicale. So we've made progress. Hip and knee surgeries, the long lists that were there are reducing every day because of the hard work and the investment in healthcare here in the province of New Brunswick. We've reduced the cataract surgeries because of clinics that have opened up in Bathurst, Miramichi, Fredericton, and there'll be more to come. So that people can see clearer and have a better quality of life, and also reduce their chance of falling, which again keeps them out of the hospital, keeps them out of the emergency room. And the mobile x-ray unit that was mentioned by Minister Holland, that mobile x-ray unit started as a pilot project, again through an agreement, federal and provincial, and it prevented, we started down in Loch Lomond Villa, and it prevented almost 340 visits of seniors to the emergency room to get an x-ray. So with this unit, you can just roll it up, x-ray the wrist, the hip, the back. It's very, very versatile. So we've expanded that right across all the zones here in the province of New Brunswick. And again, that's part of the investments that's made here to make people's lives better. So working together to improve healthcare for Canadians, this agreement is centered around the 4 shared priorities: access to surgery, access to primary care, long-term care, and an integrated, connected healthcare system. I know we've had a busy time over the last few months in putting together the agreement, and it's great that we're here today. Better healthcare is a priority for New Brunswickers. L'amélioration des soins de santé est une priorité pour les Nouveau-Brunswickois. So interesting, a couple of things I'll just highlight. We've launched the My Health NB mobile phone app. If you don't have it, it's away. I'm touching my phone. I'm not. It's right there, because the app's on your phone, and you can get your blood results. You can get all the results right there on your phone, and you can check it out. Le recrutement est une priorité maintenant. Notre personnel travaille d'arrache-pied pour notre des professionnels à haut niveau dans notre province. And I had a text from one of our staff, I think it was Tuesday night. They're down in the Philippines recruiting more people to come here and work in the healthcare system. They were in Dubai earlier, and again, that's a great opportunity where people are looking to come to Canada. And people saying, Canada's my dream country, because they can come here, they can become a citizen, and they can work and help us in our healthcare system. So I could go on, but I know that there's other people that want to get to this podium. And so I will say encore une fois, merci beaucoup, Minister Holland, et les autres ministers, mon ami Dominic et Jeanette. It's great to see you. And let's keep up the good work. I know the next speaker is a friend who's been following me. She was on Riverview Council and then became a provincial MLA, and now she's a minister, and our offices are just à côté in the Department of Health. And she's doing a great job, mental health and addictions. That's a tough portfolio. We know it's tough, and she's working very, very hard. So without any further ado, please welcome Minister Sherry Wilson.
Well, good morning, everyone. Bonjour à tous. C'est un plaisir d'être ici aujourd'hui. Merci, Minister Holland, LeBlanc, et Petitpas Taylor, Fitch, et Bacchus d'être ici. This is going to be great news for New Brunswick, and really appreciate you all being here today. This is a great day indeed. Since becoming minister responsible for addictions mental health services, I've seen how much the Department of Health is doing on addictions and mental health. One of the key pillars of our provincial health care plan is addictions and mental health, to address the very real struggles individuals face. Mental health and substance use disorders are a concern for the people who struggle with them, for their loved ones, and for our communities. The Government of New Brunswick is working to increase the availability of addiction and mental health services across our province. We're making a progress on this plan. We've seen 8 initiatives of the addiction and mental health portfolio completed, while 1 is still in progress. One of our jobs is to provide the resources to the people who need it most, because that provides hope. And where there is hope, there's a chance to recover. And that's where this funding comes in. We're working on projects that will improve the health of New Brunswickers, and it is so important that we offer evidence-based treatment and supports to these individuals who are working hard on a journey to recovery. Beyond hope, we have tangible accomplishments to celebrate and more to complete. We've launched the Planet Youth New Brunswick, a 5-year project to assist communities in finding ways to reduce substance use amongst youth at 4 sites across our province. This allows us to help them to be more resilient and reach their full potential, while giving communities a framework to make long-term changes to create healthy communities. We've also partnered with philanthropic organizations to provide young New Brunswickers and their families easier access to mental health and addiction supports through integrated youth wellness hubs around the province. We've also launched new addiction centers, services center in Campbellton. The Center for Hope and Harmony, managed by the Vitality Health Network, is now treating patients. It is part of a $24.5 million effort to improve access to detox programs and concurrent disorder treatments for those struggling with addiction. The center has added 6 beds for a total of 24. With the increase in the number of beds, here going from 18 to 24, this center will help improve access to care for clients from across New Brunswick. Ce projet est une initiative du plan provincial de santé. The department has also introduced several resources to improve access, including open access to one-at-a-time therapy, which is now available at all community addiction and mental health clinics. The Bridge the Gap website offers online resources designed to support mental wellness. The New Brunswick Addiction and Mental Health Helpline is a free, confidential, bilingual 24-hour service for citizens dealing with various addiction and mental health concerns. As of August 2023, Ridgewood Addiction Services has changed from 28-day rehab program to a concurrent disorder live-in treatment program. 4 beds were also added to the concurrent live-in program. So we look forward to making further progress on delivering on initiatives outlined in the plan. So thank you, merci. And now I'd like to turn the microphone over to my friend and colleague, Kathy Bacchus, who's been doing incredible work as Minister for Seniors.
I always tease they picked me as Minister for Seniors because I have the most gray hair and need these. Oh, thank you, Minister Wilson, and good morning, everyone. Bonjour. It was so nice to meet you, Minister Holland, and to renew and say hello to Minister LeBlanc and Minister Petitpas-Taylor. I'm so pleased to be part of this announcement. What wonderful news for New Brunswickers and New Brunswick seniors. As we heard earlier, New Brunswick has the fastest growing population of seniors in the country. Like our colleagues at the Department of Health, the Department of Social Development has been working hard to prepare for this growth and meet the needs of seniors. As Minister responsible for seniors, I believe all seniors deserve the opportunity to age with dignity and in comfort. Making this possible takes a collaborative effort. In my role as Minister, I have had the honor of hearing from seniors from around the province on what it is they want and need. I can't expect to know that listening to somebody sitting in an office in Fredericton or Ottawa or wherever. The thing I hear the most is our seniors would like to age at home and in their own communities. This is an important part of the provincial health plan, and we continue to work on a number of initiatives, including the ongoing expansion of the very successful Nursing Home Without Walls program. This program gives those aging at home the opportunity to utilize the various services provided by nursing homes. And although we've been focusing on helping seniors age at home, we are still making sure that those who reside in nursing homes have the care they need, and we are working hard to reduce assessment times for that long-term care. We need a stable workforce to ensure New Brunswickers receive the right care at the right time in the right place. And we've been working closely with our partners to make this happen. To address staffing challenges in the province, Social Development partners with a number of government departments, as well as the New Brunswick Association of Nursing Homes, the Association of Special Care Homes, individual nursing homes, and other senior-focused stakeholder groups. Social Development continues to be a leader in supporting nursing home recruitment with the international recruitment efforts. The departmental staff has been an integral part of hospital teams as they work to find the right level of care for those waiting in hospital. Initiatives in the bilateral agreement, like care coordination, will certainly aid in the effort to ensure people receive the right level of care that meets their needs. Ensuring long-term care facilities have the tools to care for people is also important. Ventilation upgrades, structural and condition assessments, and other items mentioned in the agreement will help us ensure these vital facilities have what they need. I am very excited about what is to come with this new partnership as we continue to work on making sure this important network has the means to meet the needs of our seniors. So let's get this agreement signed. I'd like to invite Minister Petitpas-Taylor back to the podium.
Thank Thanks so much, Minister Baucus. Now I'd like to ask Minister Fitch and Minister Holland to come up front, and perhaps the other ministers can just be in the background here for the official signing of the agreement.
Mark, sign your real name. There it is. Mr. Senior, wear your glasses. You have your glasses. No, hold on. You sign where Sherry. Look up. The amounts are blank, that's weird. I'll fill the check in later. I'll fill the check in. Check's in the mail. C'est Dédé. Down here. Don't hold my breath so long.
Excuse me. Is the mic on?
Okay.
All right. Thanks, everyone. Yeah, I can hear. All right. Oh, great. Mic's working. Thanks, everyone. Merci beaucoup, tout le monde. Nous allons maintenant passer à la période des questions. If you have a question, please line up in the mic behind me. Reminder, you get one question and one follow-up. Please state your name, your outlet, and your questions directed towards. And for the folks on Zoom, we'll do the questions in the room first and then go to the Zoom for questions. Thanks. Alors, encore une fois, si vous avez des questions, veuillez s'il vous plaît prendre une file derrière moi pour poser vos questions. Vous avez une question puis un suivi. Merci.
Bonjour. Oui, Louis-Philippe Audio, Radio-Canada. Juste, il y a eu beaucoup d'annonces en santé. Si vous pouviez nous aider juste à démêler un peu tout ça. Il y a eu, évidemment, il y a un an, disons, la grande entente à travers laquelle le fédéral versait 900 millions de dollars à la province. Il y a aussi l'entente travailler ensemble sur 3 ans avec des priorités communes et partagées. L'annonce d'aujourd'hui, c'est un nouvel argent, ça s'inscrit dans ces deux enveloppes-là. Si vous pouvez juste nous aider à démêler tous ces fonds qui sont investis en santé aujourd'hui.
Je peux reprendre. Alors, il y a beaucoup d'actions que les provinces prennent dans le domaine de santé. Et c'est pour nous le temps avec 200 milliards de dollars dans les prochains 10 ans. C'est une amélioration, ça va augmenter l'action et l'amélioration de notre système de santé. Spécifiquement ici, il y a des ententes pour 3 ans, plus que 400 millions de dollars. Et ça va s'assurer que les personnes peuvent accéder à les soins de santé, particulièrement d'augmenter le nombre de médecins, le nombre d'infirmières et d'augmenter l'accès pour l'information et pour les données. Et aussi de prendre l'action pour les années et dans le domaine de la santé mentale. Mais c'est vraiment avec un esprit de coopération d'augmenter l'action qui existe avec une amélioration, avec plus d'actions que existe actuellement.
Mais donc les fonds annoncés aujourd'hui, c'est l'enveloppe travailler ensemble.
Oui.
C'est pas des fonds additionnels à cet accord.
Non, c'est vraiment les fonds additionnels. C'est parce qu'il y a des budgets provinciaux et dans le budget, il y a des dépenses provinciales ou territoriales. Et c'est évident là qu'il y a des actions que les provinces prennent. Mais c'est l'argent ici et l'argent additionnel. Mais c'est évident dans le budget, oui. Mais avec l'entente, c'est notre objectif de s'assurer que c'est visible. L'argent fédéral est visible. L'argent fédéral va faire des choses spécifiques. Et aussi, il y a des indicateurs qui sont communs partout au pays. Alors, c'est possible avec les indicateurs de voir le progrès dans chaque province et territoire. Et chaque année, les provinces vont publiquement publier les indicateurs et c'est possible aussi de voir l'action et le progrès dans les données.
Merci.
Noem Sindike, RDI, ma question c'est pour M. Leblanc. Alors c'est une question qui vient de nos collègues de la colline parlementaire à Ottawa.
Oh vraiment? C'est pas à propos de l'annonce aujourd'hui?
Non.
Ah,
ok.
quelle surprise.
Si vous permettez. Alors, je me fais juste le porte-voix de mes collègues.
J'ai bien.
Ok, qui disent que le Royaume-Uni, les États-Unis et la Nouvelle-Zélande accusent la Chine d'une série de cyberattaques contre ces institutions. Êtes-vous au courant d'attaques semblables contre le Canada et surtout, est-ce que nous appuyons les accusations de nos alliés?
C'est sûr que nous sommes au courant des menaces des cyberattaques. La Chine est un pays où on voit ce genre d'activité. Ce n'est pas le seul pays. On a eu hier soir une rencontre avec les ministres des 5 pays. J'étais sur une rencontre vidéo avec le secrétaire américain de la Sécurité intérieure, la ministre de la Sécurité publique de l'Australie, celle de la Nouvelle-Zélande aussi, et du Royaume-Uni. On a constaté un peu dans les conversations ce genre de menaces-là. Vous savez, notre gouvernement a investi d'une façon importante afin de protéger l'infrastructure essentielle contre des cyberattaques. Et une des choses que les agences de sécurité nationale nous disent, c'est de ne pas discuter et les mesures qu'on a mises sur pied et d'où viennent les menaces. C'est un élément essentiel, je pense, de rassurer les Canadiens. Moi, je suis tout à fait confiant que nous avons des systèmes qui sont à la fine pointe de la technologie. Cependant, il n'y a pas un pays qui n'est pas sujet à ce genre de menaces-là. Alors, en travaillant ensemble avec les 3 alliés que vous avez suggérés, c'est peut-être la meilleure façon de bâtir une résilience face à nos systèmes d'infrastructure en termes d'infrastructures essentielles.
Alors, nos collègues de CBC, la colline parlementaire, voudraient que vous répondiez à la même question, mais en anglais, si vous le voulez.
So I actually participated in a Five Eyes meeting last evening with the Public Security and Interior Ministers, the Secretary of Homeland Security for the United States, the British Home Secretary, and our colleagues from New Zealand and Australia as well. We continue to work as a group of Five Eyes countries in terms of building up the resilience for critical infrastructure. No country is immune from the threat of cyber attacks. China is certainly one of the threat actors in this area, but they're not alone. There are other countries that are active in this space as well. One of the things that we can do is invest in the best cyber defense possible, and we can share best practices with the allies that you mentioned, with Australia, the United Kingdom, the United States. So those are ongoing discussions that we have in regular meetings of national security ministers, particularly of the Five Eyes community.
Hi, Alex Johnson from Brunswick. I have a question for Minister Fitch. I was wondering if you could expand on, you touched briefly on sort of the international recruitment efforts going into addressing labor shortages in healthcare. I was wondering if you could talk a little bit more about what the province is doing with that.
Sure. Since we're working with the RHAs and the long-term care sector to find additional people to come to Canada and work in the healthcare system. It could be personal care workers, it could be RNs, and of course physicians as well. So since I became minister, we've created a human health resource division within the department, which help coordinates all that. So for instance, there was a group that went to Dubai just in February, and we had Shanix from the long-term care sector and Horizon from the RHA, and interviewed probably, the results were very good. There was about 135 individuals that signed to come to Canada and work in the healthcare system. And just as I mentioned, the team is down in, they were in Philippines, and then moving to Thailand, and they had a goal of about 125 as well, and they were over 60% of that goal. So it's an opportunity again to augment the workers that are here now, and we have need for those people, whether it's to keep beds open in the nursing homes to allow long-term care patients to move through the healthcare system, or on the floor of the hospitals. And we've worked with the Nurses Association to remove a number of barriers of people coming to Canada, either in by paying for their registration, and also having navigators to help them navigate the system when they arrive here. So it's been a really rewarding experience, and I met with some of the Filipinos that are working in Shanix, and they're so excited to be in Canada. And it's good to see that result, because I know they're going to treat the patients well. We were down in Loch Lomond Villa in St. John, and there was a young gentleman there who, again, was so excited that he could use his full scope of practice to help the seniors there.
Sorry, I'll keep it going for a second to follow up just on the tech upgrades. Are you able to say anything more about who's going to be doing that work and how that's going to be?
In the budget, we had $10 million for the CIS, which is the Integrated Communication System, which is a long-term project. But some of the shorter-term projects are the electronic medical records, which will, again, whether it's through HealthLink or some of the collaborative clinics, through Vitality or in the family medicine. So upgrading those systems so that electronic medical record can be available when people present themselves is going to, again, improve their experience when they present themselves to the clinic for treatment.
Hi, my name is Suzanne Lapointe. I'm with Global News. My questions are for Minister Holland.
Good luck.
So my first question is, there's new data out from the Canadian Institute of Health Information, and it shows that family doctors are increasingly practicing specialty care, moving away from traditional family medicine. What does the government plan to do to make sure more people choose to stay in family medicine so that Canadians can get the primary care they're looking for? And how are you going to further entice more people into family medicine, given the rising cost of setting up practice?
Well, thanks. It's a great question. And you know, access to primary care is essential. Making sure that somebody can go and see a doctor when they're having an issue or for that preventative checkup. It's not just a matter of social justice. It really is prevention. And it means that things get caught early and we don't wind up with disastrous health outcomes or extreme cost. One of the things I'm very preoccupied, and I know Bruce feels the same way, is we have to cut back the amount of administration and duplication and frustrating processes that exist for doctors. I talk to so many doctors who say, you know, in the area of family medicine, or frankly, in medicine generally, who say, look, I love my job, but I have to send this form 5 times, 5 different ways, fax it, write it. Our systems don't talk to each other. That's inefficient, but it also creates deep frustration. We do need to have more people entering family medicine, so across the country we're working to see the number of spots increased. We're working, as we did in Charlottetown when we got together as health ministers, to talk about a 90-day service standard for recognition of foreign credentials, working with the College of Physicians and Surgeons to accelerate their process for recognition, working with the Minister of Immigration to bring more people to the country who can do that work. So we've got to come at it kind of from every possible angle. But again, the reason I start with that administrative piece is because it is such a frustration. Doctors having to work in legacy systems that don't make sense, frustrating them or pushing them into other areas.
Thank you. For my follow-up question, the federal government and New Brunswick's provincial government have at times had friction when it comes to health spending. For example, just last week, the feds clawed back $1.9 million in health transfers. Are you on the same track when it comes to how this money is being spent, seeing as there's been some issues in the past?
Sure. You know, I think it's a feature, not a I mean, it's a challenge, but I think it's a real feature of our system that we have a federation and that we have different views and we work through them. And it makes us better. When we disagree, a disagreement is an opportunity to hear each other and hear a different perspective and try to find common ground. So I know Bruce and I, you know, when we get an opportunity at federal and provincial tables, we're not going to agree on everything. If we did, that would be deeply concerning because it wouldn't be representative of our democracy. But that push and pull requires us, if we're doing our job, to listen. And I think what Bruce understands and I understand is people don't care. Like if you're interested in healthcare, you don't give a damn about what your partisanship is or your jurisdiction is. They want to see us work together and to listen to one another. And chances are, if you're in an argument, that both sides have a point to be made that needs to be heard and worked through. So, you know, on diagnostic care, as an example, that's something we're working through. We have a responsibility in the carriage of the Canada Health Act, and the provincial government here has responsibilities that it has to adjudicate. We both have constituencies that we represent. So I think that's a positive thing, and I think we're working through that very positively. In fact, I would say, you know, over the last year, the conversations that we've been having as health ministers have been incredibly constructive, and that friction you're describing pushes us to find solutions and think differently.
Are you finding a solution on this $1.9 million issue with the diagnostics?
You know, I would say I'll go back to the announcement that I made a couple of days ago in Ottawa. You know, with respect to diagnostic care, it is our belief that no Canadian should have to pay for their health care, and that includes for diagnostic care. And we've been working with the provinces this year, way more money rebated back to provinces than charged in deductions, because basically those deductions occur because a patient was in a situation where they had to pay for their diagnostic care. So we see way more money now flowing back to provinces as we work with them. So there's lots of opportunities to work collaboratively to get that money to flow back. We're seeing that positively happen, and I'm sure that we'll have positive conversations here.
I'm Sarah Seeley from the Times Transcript. And my first question is for Minister Howland. I was just wondering if there's any specific criteria or limits on what this money will be spent on, if that's been part of the discussions with the government.
Well, what we said is, you know, it's not up to us to come in and tell provinces how to run their health systems. This is really based around common objectives, common principles. So there are 4 working areas that have been talked about. Really making sure that we're taking collective action on health workforce. We've got a crisis right now in health workforce, so we can make sure that we have the doctors and the nurses and the personal support workers that we need within our health system. That we have the opportunity for seniors to be able to ideally age at home for as long as possible and provide them supports there, and where not possible for them to be able to have places to age with dignity in their own communities. The data piece, and I think it's very present here in the agreement, We don't think a lot about data outside of health. When I knock on doors, people don't talk about it. But if you're in health, then it's all you think about a lot of times, because there are so many things that are frustrating to try to get systems to talk together, to make sure that you don't have to repeat processes or repeat forms. So there are many areas of sort of common, what I would call common ground that we're operating from. And so what we did is we set a framework within that to say provinces understand what works here in New Brunswick isn't going to be working in Alberta, right? And the solutions that are needed here are not going to be the same as are in another province or territory. So there's enormous flexibility inside of these plans, and it's really about how we can work and support one another in the journey of improving our healthcare system. And that's what you would have seen here, and that's why each of these agreements is different. But there were really two things that we asked. One, that any federal money going in, we can actually see exactly what specific difference that is doing. So this concept of demonstrating that incremental spend. And then the second piece, and this is huge, is having common indicators. So that we can every year have a report from every province and territory on the same indicators across the entire system, so you can see how we're moving against that progress. What you measure, you achieve. And so it's extremely important for us now, for the first time, to have common indicators across our health system, so we can see how each province and each territory is doing, not as a function of punishing or shaming, but as a function of, we need to do more in this area, we're making progress here, we're not there. So it's not so anecdotal, because I think that's really frustrating. When I go around and I talk to health professionals, they'll tell me what's working and what isn't, but they can't demonstrate it in data, and therefore it's very hard to then be able to act. It needs to be rooted in evaluation, it needs to be rooted in data, it needs to be rooted in science. So that's one of the things I'm looking forward to convene health ministers and have those conversations around the next steps. For me, data, interoperability, reducing administrative burden, these are things that we can do together and I think represent an incredible opportunity.
And my second question is for Minister Fitch. I was just wondering what proportion of this money would be for ongoing projects that have already been started, and which would be for new projects?
Thanks. Good question. And there are a number of projects that we mentioned during the speeches, like the mobile X-ray units that this funds would be directed to. Plus also some of the mental health and addiction initiatives that Minister Wilson mentioned, like the Youth Hub and the one-time access. There's a number of things like that. I'm going to be doing my estimates in a week's time and probably rolling out a lot of those details as time goes on. But there is quite a substantial amount of work that's gone into documentation and some of the KPIs, and looking forward to, are we improving the system with these investments?
Bonjour, Cédric Thémin pour l'Académie Nouvelle. Une question pour M. Fitch ou pour M. Miller. Vous avez déjà un peu répondu, mais vous aurez l'occasion de le refaire si c'est le cas. Le gouvernement fédéral a déjà augmenté ses investissements dans la santé par le passé. Ça ne s'est pas forcément traduit par des améliorations aux services de santé fournis aux citoyens, mais plutôt par des augmentations de salaire. Comment vous allez être sûr cette fois que ces investissements vont véritablement améliorer les services donnés aux patients?
Oui. Il va y avoir des indicateurs, et dans les indicateurs, ça va être évident que le progrès est là, premièrement. Deuxièmement, comme j'ai déjà expliqué, dans l'entente, c'est l'argent additionnel que le gouvernement fédéral va donner, et c'est indiqué clairement, et c'est évident dans l'entente que toute l'information est là avec l'investissement fédéral. Et troisièmement, il y a 200 milliards de dollars pour 10 années, mais l'entente est pour 3 ans. Alors, il y a une occasion de travailler ensemble dans cette période-là, et après 3 ans, il y a une occasion d'évaluer le succès de notre collaboration. Mais je vais dire clairement qu'il y a un bon esprit de coopération ici avec le gouvernement de Nouveau-Brunswick. Et c'est clair avec Bruce et avec des autres ministres provinciaux ici qu'il y a une attente, un vrai effort d'améliorer notre système de santé. Alors, il y a des choses de s'assurer que l'argent va être investi dans le système de santé. Mais à l'extérieur de ça, il y a bon esprit de coopération et avec ça, je suis vraiment sûr qu'il va y avoir des succès dans ce domaine-là. Do you have anything else you want to say?
Non, ça c'est très clair, une bonne réponse. Et je connais bien les personnes qui travaillent dans le système de santé et aussi les personnes qui travaillent dans le département de santé avec les indicators et nous travaillons trop, regarde les indicators, c'est wait time or for surgery, ou les autres, c'est la cataracts, the wait time, the wait line, and reducing things like that to more or less a national average is part of those indicators to know that we're moving in the right direction.
Ok, alors une petite question de suivi pour vous, Monsieur Fitch. On parle d'une entente pour 3 ans, c'est les 3 prochaines années, c'est ça? Donc j'imagine que l'argent qui est annoncé aujourd'hui n'était pas inclus dans le budget 2024-2025.
Merci beaucoup, bonne question. Et oui, c'est inclus dans le budget pour cette année parce que nous commençons la discussion l'année passée avec les autres ministres du club. Et donc, j'ai vu l'argent dans cette budget.
Hi, David Koch from the NB Media Co-op. Just looking at the press release detailing the spending, it mentions under retention, improve safety, and reduce stress in the workplace. So just wondering, I guess the question for Mr. Fitch, just details on benchmarks, goals, what safety issues do you hope to tackle?
Sure, great question. And we know that there's no place for violence in the workforce. So the RHAs are working with staff in order to prevent some of those indicators of violence. And the other part of your question, when we talk about some of those indicators of how we're improving the system, again, looking at some of those national benchmarks, like the wait time for MRIs. If we're over that national benchmark, which let's say it's 40 days, using the system, whether it's electronic scheduling or self-scheduling, in order so people have more input into when they have that MRI or where they have it, because the wait time in Miramichi is much shorter than Greater Moncton. So folks can book up in the Miramichi, go there, and get their non-urgent MRI quicker.
Sort of from a labor perspective, in terms of retention.
Oh, okay, sorry. Right, well, part of that whole discussion on the workplace and the safety and having enough people on the shift to make sure that you're not short-staffed, that's where that retention comes into place. So whether it's increasing the number of RN students in schools, when we took over in 18, there was about 888 RN students. Last count, there was 1,689. So we've almost doubled the number of students going through the system, and UMB St. John has actually reduced the number of years to 3 as opposed to a 4-year degree. So having the international recruitment, having the recruitment throughout Canada, and also having more students will make sure that there are appropriate number of people and the appropriate number of care providers to make the workplace safer. And if workplace safer, it's a better experience. People tend not to be as disheartened and consider leaving.
Okay, and just for the follow-up, it mentions in the press release expanding accessibility for insulin pumps in particular, and I know that also it's C64 at the federal level. There's some information. I think there's supposed to be some coverage for insulin medication with respect to that. We hear a lot about people struggling to afford insulin medication. So just wondering if you could say more about this, and particularly is the goal ultimately universal coverage for diabetes? I guess that'd be for
absolutely. So let me be clear. The legislation we put forward in Parliament would would establish the framework and the dollars for us to work with provinces and territories to establish universal coverage for diabetes drugs, and to create a fund that would be for the apparatus that support diabetes. So you mentioned, whether or not it's test strips or it's syringes or it's monitors or pumps. And so I've had a conversation, Bruce and I, about this. We have some work to do, just like this agreement and the Aging with Dignity, both the Aging with Dignity and Working Together agreement required some time to work through the details. But to be clear, it would mean that somebody, regardless of their age or income, would be able to get access to the diabetes medication they need. And let me just talk for one quick second about why that's so important. I've said this, and I don't think I can say it enough. When I go into diabetes clinics, and I talk, like Sarah in Ottawa was talking to me about, meeting patients who, when they don't have their diabetes medication, wind up coming into that clinic and need to get a limb amputated, or wind up in a situation where they're having a cardiovascular event, and how devastating that is for a healthcare worker. We're talking to people who are dealing with diabetes patients who can't afford their syringes, so they're reusing syringes and then getting a blood-borne disease. This is not things that should be happening in this country. So I'm deeply hopeful that all parties will come together and set aside partisanship and do the right thing to support diabetes medication. I could speak about universal contraception, and I won't, but that's equally as important and also part of that bill that's before the House.
All right, thanks everyone. Due to time constraints, we'll have to end things off here. Thanks so much.